Hello, my name's Amy Goodman, and I'm the co-director of the Autism Now Center. This is the 35th video in our Autism Now Answer series. The question for this week is, what is Medicaid, and what services are covered for children with an ASD? I am here today with my colleague, Annie Acosta, to tell you about Medicaid and what services are covered for a child with ASD. So, Annie, why don't you tell me a little bit about what exactly is Medicaid?
Sure. Medicaid is the nation's public health insurance program for people with low incomes. The federal government sets minimal levels for groups of people to be covered and services that have to be provided. States then have the option of going beyond that and covering more people and more services if they want to do so. The program currently covers about 9 million people with disabilities who are under the age of 65, and it's known by different names in different states, such as Medi-Cal in California or Badger Care in Wisconsin.
So, what services does it cover for an individual with an ASD?
These fall into two basic categories for all beneficiaries, and these are healthcare and long-term services and supports. Healthcare covers things like doctor's visits, surgery, hospital stays, and prescription drugs. And long-term services and supports covers things that have to do with activities of daily living, like help getting dressed, managing money, making meals, and it even includes supported employment. One of the challenges that people with disabilities have is that long-term services and supports in the community are optional for states. And since they fall into this category, states can limit who gets what. They can say that somebody can only have a certain amount of service hours per month, or they can just put people on waiting lists for some services.
So, are there more specific services that Medicaid can cover?
States generally get to decide what this means. But the federal agency that's in charge of the Medicaid program, the Centers for Medicare and Medicaid Services, known by its acronym CMS, just recently made it clear that one particular part of the Medicaid program, known as EPSDT, which is the Early Periodic Screening, Diagnosis, and Treatment Program, must cover medically necessary services for children with an ASD.
So, do services for children with an ASD have to be provided by a licensed practitioner?
Depends on the state, and it depends on what services is being provided. The service that's getting a lot of attention these days is ABA, or Applied Behavioral Analysis. And this is mostly because there have been a number of successful lawsuits in the states to require that the states provide ABA services. And in the case of ABA, 19 states right now have some type of licensure for those providers. But since so few of these states have the licensure requirements, they're allowing people who are supervised by licensed providers. And this is important because providers sometimes charge a lot of money for their services, and having supervised staff provide at least some of those services makes it more affordable.
When do the states have to start covering these services for children with an ASD?
There's no hard deadline right now. CMS is going to be working with the states in the coming months to approve what's known as a state plan amendment, where the state proposes the specific service to cover, the number of hours, and the rates that they'll provide for those services.
So, are there other services besides ABA that have to be covered?
Yes, CMS made it very clear that there are other medically necessary services that states have to provide for children in this EPSDT program. However, CMS is not specifying what those services are. They mention that there are a number of resources that describe the evidence base for different services, and they even included one report as an example of that in their guidance. And this report mentions 15 interventions that have been identified as having the highest level of evidence, and they include things like cognitive behavioral intervention package and social communication intervention. But again, states get to propose the specific services that they intend to provide.
Okay, so can the states limit the amount of services for a child with an ASD?
Yes, but within reason. So CMS is going to be deciding on a case-by-case basis whether or not to approve these state plans. that lists the type and amount of services.
So, who is eligible to provide services to a child with an ASD?
Once again, states get to decide this. So each state has a law that specifies what type of credentials providers have to provide different kinds of services. And these are known as scope of practice laws.
So do the states provide services to adults as well as children with an ASD?
They do, but it depends very much on the person's eligibility and the specific service that we're considering. So to qualify for Medicaid, adults have to have very low incomes, and these vary considerably by state, but they range between about $6,000 a year and $16,000 a year. So as I mentioned earlier, states have to provide the health care services, but they don't have to provide the long-term services and supports in the community. And I say in the community as opposed to an institution. Now, all states provide some type of long-term services and supports in the community, but there are waiting lists for many of those services.
So what can state advocates do to ensure that Medicaid programs cover ASD services as soon as possible?
That's a great question. So they should first get in touch with their state Medicaid directors' offices and also just learn about any opportunity in their community for stakeholder input. We anticipate that there will be a number of such opportunities in the states, but they're going to completely depend on the different communities that one lives in. So it's a great chance to learn more about what the state is planning to do and to weigh in on the importance of different services for children with ASD.
Well, thank you, Annie, for joining us today. And thank you for watching this video. I hope it's been helpful, and I hope it has helped you with your journey into autism. And just remember, the more you know, the more empowered you will be.